Barihab is a high-low table, you can use that feature to assist with your transfer training. That helps accommodate the patient's height. Raising the surface makes the task a little bit easier for doing your sit to stand. Lowering the table is going to make it more challenging for that individual. For those patients you're working with who may have some additional motor coordination problems, such as inability to keep their foot in one solid position, there's an additional feature that's built into the Barihab, which is the foot plate, which I'd like to show you next. Simply by raising the table, you'll notice that between the transfer bars, the foot plate sits tucked up underneath the table, simply accessed by pressing upward on the foot plate, allowing it to come down into the locked position, and then adjusting the table height to your given need. This now provides a stable surface to prevent the foot from going back underneath the table and giving your patient a little bit more stability and support. Again, this stability and support allows you as the therapist to concentrate your time and your skill on facilitating the correct movement with the patient and reducing strain to your own body during the process. When you're done using the foot plate, you can return it to a stowed position by simply reaching underneath, behind, grab onto the D-ring, lift the D-ring up slightly, and return the foot plate to its stowed position. Now that we've discussed all the fantastic features of the Barihab, I'd like to show you one additional one that truly is revolutionary. And that is, it takes the Barihab to another level by using this knee blocker to allow this to function essentially as a standing frame. And to show this feature, I'm going to enlist the help of Shannon. Shannon, come on over. Using the knee blocker, you'll take the padded side toward the patient, and you can insert this through the bars from either side. You'll let it drop down in between the bars like so, and then using these Velcro straps, simply and easily lock it into place. Depending on the needs of the patient and their own stability, you can adjust how far the knee blocker is from the legs. So we can slide the transfer bars inward. Once you've found the correct position, make sure to secure them using the tightening bolt. And now from here, you can begin raising the surface and assisting your patient easily into a standing position. How are you feeling there, Shannon?
Very good.
You feel secure?
Yes.
Good. Do you feel like you can fall or move at all?
No.
Okay. One of the great features here is that unlike a conventional standing frame, the feet are free to move. And this helps assist with transferring weight and progressing the patient faster than you can in the standard standing frame. Once the patient starts to fatigue, simply use the foot pedal, lower the treatment table, and assist the patient back into a comfortable seated position. If you're finished with doing your standing activities, you can remove the knee blocker. Otherwise, simply allow the required rest break and then move back to standing again. At this point, we'll go ahead and remove the knee blocker. And you'll be able to see that even though the blocker was in fairly snug against the legs, it's fairly easy to remove from that position. So some important points about the use of the knee blocker is that it really improves the number of things that you can do in your clinic setting, all from one stable support surface. You can easily work on transitioning into your standing activities, progress weight bearing. You improve your own safety and confidence as a therapist to advance what your patient can do, which helps bring them along faster. And that's really the point of treatment and what we want out of our treatment sessions. Makes it a little bit more efficient, a little safer, keeps the patient comfortable, and that's going to get you a great outcome. As you can see, all the features of the Barihab have been stowed away in their proper position, and the table height has been raised to its maximal elevation of 34.5 inches. You'll find this is the perfect height for doing a gurney to table transfer. You're able to simply bring the gurney up directly alongside the table, perform your level surface transfer, keeping you, your staff, and the patient safe. You'll further notice that underneath the table's been designed with ample space to allow a Hoyer lift or similar device to be brought in close underneath the table so that you can easily and safely position your patient onto the table. Perhaps the greatest feature of the Barihab treatment assessment platform is just its overall ability to allow you as a therapist to bring the most out of your treatment sessions. It allows you to interact with the patient personally, maintaining eye contact, keeping them comfortable and safe, reduces the stress and strain to your own body during the course of the treatment day. It reduces the need for additional pieces of equipment in many cases. It allows you ways to progress your patient that's going to challenge them better and faster than you can with other traditional methods. In the end, it's going to be a better tool for you to use to get the most out of every treatment session that you possibly can, with minimized stress to yourself, minimized risk to the patient. It's going to reduce the need to co-treat with other therapists, and overall is going to be an asset to any facility that employs its use.
I'd like to take this opportunity to thank you for just viewing the DVD and learning about all of the features that the Barihab provides. But there's one thing I'd like to remind you about. The Barihab will only be as good as your ability to use it. So I encourage you, please use it on a daily basis. Experiment with it, because you will find that it will help you help your patients improve at a faster, quicker, safer rate. Thank you again, and we'll talk to you soon.